June 2021, Nigeria, alongside other member countries of the United Nations, committed to new global HIV targets at the UNGA high-level meeting on HIV and AIDS held in New York. The main target is to end the dreaded disease by 2030. Nigerian government has pledged to adopt robust and pragmatic steps to assist in addressing and ending the epidemic as a public health threat within the period. Measures have been taken towards this direction, and there are reports that the country is witnessing decline in the number of infections and treatment of victims have increased. Now, what has been done, and is the country on the right track to meeting the 2030 deadline? My guests will speak to these issues in a short while. Stay with us. I am Joseph Otsen. Welcome to the program. On the spot this week is an epidemiologist and public health specialist, a graduate of medicine from Ahmadu Bello University, Zaria, Nigeria. He also holds a master's degree in clinical research from the University of Maryland, USA, PhD in epidemiology from same university. He also worked as a country director for the university programs in Nigeria. He is an associate professor in the Institute of Human Virology, University of Maryland School of Medicine. My guest has so many research work, including HIV, TB epidemiology, multi-drug resistance TB, HIV surveillance, malaria surveillance, prevention of HIV transmission in key population, evaluation of vaccine safety, and HIV research ethics, among many more. On the spot this week is the Director General, National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu. Nice to have you, sir.
Nice to be here with you, Joseph.
Okay. 2030 is the target. We just have 7 years left. Are we going to meet that target in this country?
Before 2018, 2019, if we were asked how we're going to meet the 2030 target, it would have been a huge task, and probably we could answer it may not be surmountable. Why? Because as of then, the number of people living with HIV/AIDS we had been estimating has been around between 3 to 3.5 million people living with HIV/AIDS in Nigeria. But after 2018, when we conducted a nationwide survey, household survey, to see the spread and the distribution of HIV across communities in the country, we find out that the number of people living with HIV is actually a little less than 2 million as of that time. So that gives us the confidence and the kind of strength and energy we're having at the moment to say we actually can do it. And 2019, when the result of that survey was presented, the president gave a directive. And that directive that was given to NACA at the launching of the results was that, having come this far, NACA should push for the last mile. At that time, we had about 800 people that are on treatment that have been identified living with HIV/AIDS in Nigeria. And our estimations show between 1.8, 1.9 million people living with HIV/AIDS in Nigeria. So if we push for the last mile, and if we push hard, we can actually identify the remaining 1 million that have been elusive for the last 2 decades. This active program began in 2005. From 2005 up until 2019, when we look at the data we have, we were only seeing 800,000 people. What we did after that directive was to get out of facilities where we have been busy waiting for patients to come, waiting for people to come and test for HIV, but to take HIV services to the doorstep of people in communities where we believe HIV is brewing. What that survey did was to tell us a lot of information that we don't know, to map out the communities across the country and identify hotspots where HIV prevalence is high, or we see evidence of HIV transmission based on new cases of HIV that have been found. And it is those hotspots that we identify that we now move our arsenal to those communities and saturate the community.
Give us an idea what the hotspots are.
Yeah, so these hotspots were all over the country, but when you look at states, you will see a local government, you will see a couple of local governments, you will see a community within local governments where cases are coming up and cases are coming out high. We move to that community, or those communities, and then saturate the community with service, meaning we never waited anymore at the facility to wait for patients to come to us. We go to their doorsteps and give them HIV services. And we tell people, and even now we tell them, that look, HIV is no longer the killer disease that you know in the past. Actually, HIV now can be managed. If you only make the effort to test yourself and find out your HIV status. If today you find out you have HIV virus in you, then 50% of your problem is solved. The 50% you leave it with us, because we will get into the system using the drugs we have and make that virus disappear. Once that virus disappears from your system, that virus cannot be transmitted from you to your loved one. And that virus cannot continue to destroy your body defense mechanism to make you sick or for the virus to show in somebody's face. This is one. Second, we're no longer seeing people coming to occupy our hospital beds because they have HIV. No. They are managing the HIV within their body, and they are making the HIV to look like it's not existing. That does not mean that the virus is not there or the virus is cured. No. All it means is that this drug has denied the virus the opportunity to multiply. And because it is not multiplying, it is not seen. So what will happen? It gives the body defense mechanism an opportunity and time to now regrow. Regrow and now come stronger to fight the virus and also to fight diseases that may come as a result of the virus. Because it's the virus breaking the body defense mechanism and then creating an opening for disease to come. So once that opening is not there, you will not see these illnesses and diseases that are associated with it. So on that note, we've done a lot, and we've moved into the society, community, and we've mopped up most of the cases of HIV that have remained. From that time when we discovered that we have about 800,000 people to now, we have added close to 1 million on top of the 800 we have. So we are having a figure of about 1.8, 1.9 million now that are on treatment, and we believe we are closer to reaching the 95 you're talking about. Yeah. It is our hope that Nigeria will reach 95 before 2025, in the next 2 years, but not later than 2025. At the rate we are going, we are very confident we'll do that.
Okay, let me take you back to the issue of denial there. We still have people who feel ashamed to come up and own up to it. And in their hiding, they could be the kind of an obstacle to whatever you are doing. They could be silently spreading the disease there. What are you doing to get to people like that? You can't just ignore them.
Thank you. This is a very important question. First of all, we're using you people, the media. You have been very helpful from the beginning of this campaign up to now. Because without you, we wouldn't have reached out to the number of people that we have reached out all over the country at this material time. However, we are continuing to partner with you to take this message to the doorstep of virtually every person, especially people that are at higher risk of acquiring the virus. And they know that behaviorally they are at higher risk of acquiring the virus. They should know one thing. No matter how much money government set aside to fight HIV, and no matter how much money the international community allocated to fighting HIV, ending AIDS is not going to happen without the cooperation and the assistance of the citizens. And what assistance we ask, or the cooperation or the help that we want every citizen to do or to give in terms of taking HIV out of our community, out of our people, and making sure that we end AIDS as we know it by the year 2030, and we no longer see HIV moving from one person to another, is for the people to take it upon themselves, to overcome that barrier, to overcome that fear, to overcome whatever is eating them inside that is preventing them from taking our services, to now come out and take our testing services. The gateway to HIV services, especially the treatment we give, the drugs are there waiting for people who have the virus to go and take them at facility. But you can't go and take them without taking the test. The gateway is the test. After the test, if you are discovered to have the virus, then you are eligible to take the medication and you can come forward. And these medications are free. They are waiting for patients to come and take them. So we are urging our citizens to take advantage of that. Come forward and test for HIV, or demand for self-test kits. You can do it by yourself, in your house, in your room. So demand for that, check your status, and know whether you have HIV or you don't have it. Especially if you know behaviorally, by your behavior, by your action, by your business, by whatever you are at higher risk of acquiring the disease, it is important to check and continue to check. You check today, you find HIV negative. After 3 months, depending on your risk, you can also take the test again to see. But if you believe you're not at risk, one test is enough. When you test and you know that you don't have the virus and you're faithful to your partner and this is the way you believe in, there is no way HIV will come. But if people know that they are at risk, it is very, very important they check regularly.
Check regularly.
Yeah, and this is the help we need. And with that, we can assure Nigerians, once people begin to demand for the service, then that is the end of HIV.
It's okay. All right. So many questions begging for answers, but we will take a short break and come back shortly. Okay.
NTA News 24 has the sole mandate of bringing news to you anywhere and everywhere.
We set standards based on current broadcast realities while consolidating on a wider reach to variety of audiences.
We go beyond the screaming headlines to verify, interrogate, and accommodate all shades of opinion without prejudice to national interest.
Our well-researched, packaged, and live programs keep you abreast of events, personalities, and current affairs.
Welcome back. Director General, National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu is on the spot. Okay, before we took that break, we were talking about testing, importance of testing. Mm-hmm. Now, yes, a lot of people in the urban areas may understand what testing is all about, but in the rural communities, in the remote areas, villages, where health facilities are not there, many are not conversant with the tools for testing, the centers to go to. These are areas we should be improving on too, to get more people to testing, because everything reduction starts with the testing.
I agree with you. We're making effort. We're working with civil society organizations. Our implementing partners, some of them have mobile testing van that goes to community or places where we believe that risks of HIV transmissions are high. For our rural areas, we will continue to use these means that you have been using: the radio, television, our civil society organizations that are on ground, community groups that are on ground, that we're using to reach out to various settlements, to introduce the services we have, and enable people to understand the importance of these services.
But are the test centers available for them there? Because yes, some of them are very poor. So moving to urban areas where maybe they will get to these test centers, maybe it's very challenging to them.
I agree.
Why can't we just take some of these facilities to them?
It may be difficult budget-wise to have a facility in virtually every place to test for HIV, including places where you believe you don't have the virus. You understand? Cost effectiveness-wise, it is important to first of all study, which is what we're doing, what we've been doing. Our services and our decisions for the last 3 to 4 years have been data-driven. We see where the cases are, we see where the needs are, and we don't even take center, we go. We go to the community, we saturate the community, we go to the household of individuals, we knock on the houses, and we provide people with services. However, for remotely located places, where we cannot take these services for obvious reasons, maybe because of logistics, maybe because there are security issues, maybe because there are other issues, we rely on information that are passed across. People that believe that they are at higher risk should make an effort, should have access to those centers that we define where they are. And if people are not sure of which center to go to, they can always call our call center at NACA, 6222. They will ask you your location, and based on the location you describe, they will direct you to the nearest center where you can have HIV testing. If you're looking for treatment, you're already HIV positive, they can also link you up with a center that is nearest to where you live, where you can take this treatment.
Okay, talking about funding and resources, the HIV Trust Fund was launched about 62 billion naira. Am I right?
It was last year.
How much have this fund impacted on the drive?
This 62 billion naira is an appeal fund. It is driven by private sector. The money doesn't come to government, and we don't manage the money. It's managed by private sector, and it's the HIV Trust Fund of Nigeria that manages it, which is actually part of NIBUCA, Business Coalition Against HIV/AIDS in Nigeria. The business community come together and feel that it is important they take the rightful place in the fight to end AIDS. And we've had discussion, and our agreement is that they're going to come in and provide commodities, provide logistics, especially for the elimination of mother-to-child transmission of HIV. Mother-to-child transmission has been one thing that we've been struggling with for quite some time, for the simple reason that not all our pregnant women access our services. And some of them that are HIV positive that don't access our services are at higher risk of transmitting the virus to their unborn baby, maybe during delivery or after delivery during breastfeeding. The trust fund is meant to support this program nationwide. From that time up until now, donations are being collected from the general public, and the big companies and the business entities that have made pledge are now being followed up, and we are having meetings with them, and it is our hope that in no distant time, before the incoming of the next administration, most of them, the key players, will have this pledge fulfilled, so that this year and going to next year, that part of the trust fund that is supposed to come and fill a gap in our budget.
How impactful has it been so far?
For now, we have not started harvesting the investment in it yet. We are hoping that by the time these pledges are redeemed, we should be able to know what do we have at hand that we are going to begin with. Because this one is supposed to be, some of them made pledges on annual donation. That means over the next 5 years, they will donate a certain amount of money annually. So we are hoping that at least most of the pledges that were made last year may be redeemed before the new government come in. And as the new administration come in, one of the key priority for us in terms of getting to on the program, because at the moment, most of it is paid by the American government and the Global Fund. As we march towards 2030, it is imperative to look inward, in country, and see how resources could be mobilized.
We know that most of the support comes from donor agencies, international donor agencies, and so on. So we need to own up. The country needs to own up.
We are owning up to our responsibility. All the pledges, the New York declaration you're mentioning, where the pledge were made to end AIDS by the year 2030, was the same platform that President Muhammadu Buhari went and made pledge that he is going to increase the number that we treat from domestic resources. Then we were treating about 40,000 people. As I'm talking to you, we're treating about 100,000 people annually, and we are increasing that number this year to about 150,000. By next year, we should sustain the 150,000 or increase it to 200,000. And we have never faltered since we started. Since we started in 2000, the year 2000, this is about 3 years ago, we have redeemed our pledge, and we have made available the resources that are required. We have made available every approvals that are required to make life easy for the program. For example, we've made a request for the president to allow us to buy commodities directly from manufacturers, and also to buy commodities directly from sourcing platforms like Global Fund. As at the time we made the request to him, we're buying a drug per patient per month at the rate of $13 from the middlemen of the vendors we get. When we started buying from sourcing platform, Gambo Global Fund, and also some manufacturers, we were getting it at the rate of $7 per patient per month. So almost half of the price. So all these approvals and the enabling environment that is required and the political support this government has provided. The president has been at every event we invited him. He has been at major HIV event 3 times by himself without representation in the last 3 years. So it has been remarkable.
Of course, the impact is being felt.
Yeah.
The numbers are decreasing,
Yeah.
and treatment is increasing. Okay, but that's where we'll stop today. Thank you, Director General, National Agency for the Control of AIDS, NACA. Dr. Gambo, Aliyu, thank you for being on the spot.
My pleasure, Joseph. I'm glad to be here, and I look forward to when next I will be here, because the business continues.
Yes, so much to talk about it.
Thank you.
And thank you, viewer, for always being there. I'm Joseph Hussein. See you on the next episode.